Today our topic is fundamentals of pathology. Pathology, this is nothing but the study of disease. It is a branch of medical science that involves the study and the diagnosis of disease through the examination of surgically removed organs, tissues, that is the biopsy samples, bodily fluids, and in some cases the whole body autopsy. Systemic pathology, this is the study of the etiology, the pathogenesis and the host response specific to the particular organ system. Here we can look what is disease. It is a state in which the individual exhibits an anatomical, physiological or the biochemical deviation from the normal one. The disease may be defined as an abnormal alteration of the structure or the function in any part of the body. Pathology, this is the scientific study of cell injury and the disease. Cell injury and the disease, the structural and the functional changes in the cells and the tissues and organs. Scientific study, applying one or more scientific method to reach a diagnosis. What we study in disease, etiology, that is the cause of disease. In case of pathogenesis, this is a sequence of events from the initial stimulus to ultimate expression of a disease. Morphology, this is the structural changes in the cells and tissues. It may be gross or microscopic one. While speaking about the clinical significance, this is the cause, that is signs and symptoms and prognosis. We can say the outcome of the disease. There are four aspects of a disease process. One is etiology, second is pathogenesis, third is morphological changes, and the fourth is the clinical significance. Etiology, this is the cause of injury and the disease. The first one is hypoxia. This is the inadequate oxygenation of cells and tissues. Second is physical agents, like it can be affected by trauma, radiation, heat, etc. While speaking about the chemical agent, we can say it is caused due to the poison, air pollutants, alcohol, cigarette smoking. Infectious agents like virus and the bacteria. Immunological reactions like because of drugs. Nutritional imbalance like because of the vitamin deficiency and nutritional deficiencies and it may also causes the obesity. While speaking about the genetic factors, it is caused due to the sickle cell anemia. Pathogenesis, it is the mechanism by which the certain etiological factors causes the disease. Pathos, disease, genesis, this is due to the development. Clinical significance of a disease. First we can go over cause, which is the progression of a disease. Next is symptoms, like what are all the complaints that patients are giving. Next we can go for signs. This is a feature of a disease detected by the clinical examination or the investigation. Prognosis, this is the outcome of a disease, either good, poor or unknown. Clinical symptoms and the signs. The clinical symptoms of the patient's complaint, usually by its own word as a pain. The clinical signs are seen only in the living individuals as the organomegaly. Morphological changes. These are the changes that occur in the cell, tissue or organ as a result of the pathological processes. The macroscopic appearance is visible to the naked eye. While speaking about the progression of a disease, there will be the complete cure, death and complication. Cell reacts to the adverse influences by all forms of the cell injury start with the molecular or the structural alternation in the cells. There are under the normal condition, cells are in the homeostatic, that is the steady state. Excess physiologic or the pathological stress may force the cell to the new steady state called the adaptation. Too much stress exceeds the cell's adaptive capacity. This is called injury. The first one we can go with the adapting, reversible injury, irreversible injury and dying. Cellular adaptation. This occurs when the excessive physiologic stresses or some pathological stimuli. This preserves the viability of the cell. Examples are hypertrophy. This is increase in the mass of cell. Atrophy. This is the decrease in the mass of cell. Reversible cell injury. The pathologic changes that can be reversed when the stimulus is removed. Irreversible injury. The pathologic changes that are permanent and cause the cell death. There are two morphologic patterns of the cell death. One is necrosis and another one is apoptosis. Necrosis. While speaking about the necrosis, this is a more common type after the exogenous stimuli are manifested by cell swelling, denaturation, coagulation of protein, breakdown of the cellular organelles, and cell rupture. Apoptosis. This is a programmed cell death characterized by occurs in the single or the small cluster of cells. Results in the elimination of the unwanted cell during the embryogenesis and in various physiological and the pathological state. Causes of the cell injury. Hypoxia. This is the decrease of oxygen. And ischemia. Loss of blood supply. Inadequate oxygenation, it is due to the cardiorespiratory failure. Loss of oxygen, that is the carrying capacity of the blood. Example, anemia, carbon monoxide poisoning. While speaking about the physical agent, this includes the trauma, heat, cold, radiation, and the electric shock. The chemical agents that are caused because of therapeutic drugs and the non-therapeutic drugs. Therapeutic drugs like acetaminophen and non-therapeutic drugs like lead and alcohol. Infectious agent. This includes virus, bacteria, fungi, parasite, and rickettsia. Immunologic reactions, genetic dearrangements, nutritional imbalances. There are four main structures that may be targeted by the injury. One is cell membrane, next one is mitochondria, protein, DNA. Biochemical mechanism of the cell injury. One is ATP depletion, another one is intracellular accumulation of the calcium, accumulation of oxygen derived free radicals, which is the oxidative stress. Next we can go for